healthcare facilities. What most people think of is hospitals. Hospitals range in various sizes and types of services that they provide. This picture is an example of a general hospital. This is Ben Taub Hospital in the medical center. A person could go to Ben Taub Hospital for a number of reasons. They could possibly go if they had an emergency, if they needed surgery, physical therapy, maybe some lab tests done, radiology services, because it is a general hospital and many types of services are provided there. Another type of hospital is a specialty hospital. Specialty hospitals are those that care for only special conditions or age groups. This is an example of a specialty hospital. It is Texas Children's, also in the medical center. Texas Children's services children who are under the ages of 18 to 21. This is an example of a government hospital. This picture shows the old Walter Reed Army Hospital here in front. Building in the back was the Walter Reed Army Medical Center. At the time, it was the Army's largest healthcare facility and the largest in the Department of Defense. However, this medical center closed in 2011 when it was merged with the Bethesda Naval Hospital. If you remember back to History of Medicine, Walter Reed was a general in the Army, and he was also a doctor, and confirmed that mosquitoes carried yellow fever. Another type of hospital would be a university hospital. This is a picture of Baylor University Medical Center. The university hospitals provide hospital services like a general hospital, along with research and education. Other types of healthcare facilities, there would be long-term care facilities. Long-term care facilities provide assistance and care for individuals with various types of disabilities, handicaps, or long-term illness. Also, you see long-term care facilities for maybe elderly patients. Another example of a facility would be a medical office. Medical offices, like this one, can either be privately owned by one doctor, group of doctors, or a corporation, and they can be general or specific. Medical office could be a pediatrician's office for children. If you had a heart problem, it could be cardiology, where a cardiologist would have his office, or an ophthalmologist, depending on the specialty. Here's a picture of a dental office. Dental offices, just like medical offices, can be privately owned by one dentist, a group of dentists, or a corporation, and they can be general or specific. For routine dental cleaning, it would be a general dentist, a person who needed orthodontics to straighten their teeth or to help their teeth become more straight in their mouth would be orthodontist, and that would be a specialty. Here's an example of a clinic. A clinic is a place where groups of doctors or dentists, depending, could share a facility or provide special care. This is an example of a county clinic. You see these in various places. They can be set up outside of a hospital or away from a hospital or somehow related to a hospital. Here's an optical center. This is an old Texas State optical picture. Optical centers also, like medical centers and dental centers, can also be an individual or part of a corporation or a chain. You can also have some satellite emergency care services. These can provide care for victims of accidents or sudden illnesses. There's a couple in our area on 249 that one is connected with two local hospitals, and people can go there if they become suddenly ill or with minor emergencies. Laboratories are usually part of another facility. For example, in like a general hospital would have a large laboratory, and you can go there and have blood tests run if you would need to. Also, laboratories can operate as satellites. For example, one that you see a lot is maybe Quest Diagnostics. They have satellite offices where they take blood samples, and then the blood gets sent to a central location where the blood is processed and uh, various tests are run. Home health care is another area of kind of not really a facility, but maybe conceptually. Home health care is designed to provide care in a patient's home. So, this lady here may be recovering from an illness or an injury, um, maybe requires some physical therapy to help get around. It is well known that patients tend to do better when they go home because they're more comfortable at home. So, quite often you'll see patients who are well enough to go home but need some assistance will get some home health care help in. Uh, that's usually can be paid for by the insurance company so that they can go home and recuperate faster. Hospice is specific care provided to terminally ill persons with life expectancies of 6 months or less. It is usually directed toward allowing the person to die with dignity and in comfort. Notice the dog here. There is a whole range of therapy related to pet therapy, and sometimes this is maybe be used in hospice care. Mental health. Mental health centers treat patients with mental disorders and mental diseases. There's also genetic counseling centers. Genetic counseling centers work with couples or individuals who are pregnant or considering a pregnancy. This may be uh, in relation to a, a, a future parent who may have some type of genetic abnormality in their family history. So, if it's an inherited disease that may run in the family, something like sickle cell anemia, it could be Huntington's disease, Tay Sachs, a number of inherited disorders that a couple may want to know what the likelihood their child is of having this, so that they either know so that they know what to expect. There are also specific rehabilitation centers. Rehabilitation centers provide assistance to help patients with physical or mental disabilities care for themselves. Um, there's a wide range of rehabilitation centers. There can be from people who are in rehab because of a drug addiction, maybe alcohol addiction, um, and or some type of mental issue that they need some rehabilitation. So these facilities are designed to help people with those problems. Okay, health maintenance organizations or HMOs provide total health care directed towards preventative health care. Um, these became popular quite a few years ago, where patients would go to a doctor who was their uh, family doctor, and that doctor would treat them for most things. And then if something occurred with a patient that required a more specific treatment, that primary care physician would then refer them to another physician. It's a way to manage health care and try to give patients the utmost in preventative care. Inside many businesses or organizations, there are industrial health centers or occupational health clinics. For example, a large company may have a health facility where the employees can go to maybe to get things like flu shots, routine drug screening, um, routine cholesterol checks, just general kind of things to make available to the employee. Um, they Sometimes the flu shots are free, sometimes they're not, but they are a good. Most companies have one of these or have something close by. Okay, one that most students are familiar with is school health services. In most schools and colleges, you will find that there are health services. What most students are familiar with is the nurse's office. Nurse's office can do things like in this picture, where they do routine vision screening. They also maintain medical records on students, shot records, and various other things. They also have medications that students maybe have brought to school because they've been ill and their parents turn in forms for that, and they store that here, or diabetic students or students with other medical issues. Also, in colleges, there are school health services. Many college students board away from home and need access to health care.